Asha, you're live. You can address the crowd.
Pardon me?
You're live.
Yeah.
No, we're standing right for Q.
Yeah.
Oh, we're waiting for a cue?
Yeah.
Okay,
So we're almost there.
I'm very cute. Just wait for that. That's cute.
Okay. Welcome to all of you watching on Facebook and YouTube. I'm Asha Tomlinson with CBC Marketplace, and we're really continuing the conversation today around our latest investigation, a show that aired just this past Friday about abuse and neglect at long-term care homes caused by both residents and staff. And what we found through hidden cameras were really, it was disturbing, it was shocking. There are so many people who said that it struck a chord with them. We've been receiving tweets, Facebook comments, YouTube comments, emails, just talking about, people who have experienced the same things, sharing their own stories. And a lot of people are left wondering, how can I protect my loved one? How can we improve care at long-term homes? So we're here with Jane Meadus, and she is an advocate. She's also a lawyer with the Advocacy Centre for the Elderly. Thanks for joining us.
Thank you for having me.
And we want people to send us their questions. I mean, this is such an important discussion to be had. We're here to answer each and every one of your questions. Jane is the expert. You are in our program. And I mean, you hear about these stories every single day for the last 2 decades.
That's correct.
And I guess, just to start off and to kick things off, in Ontario, reported cases of abuse, particularly where we have the hard numbers, have doubled in just 6 years. So every single day we're talking about 9 residents being harmed by another resident, and 6 are harmed by staff who are supposed to care for them. Is this what you're hearing in your day-to-day? I mean, what are some of the what are some of the stories? You hear everything, but what are some of the stories you get?
I mean, we really hear everything, and abuse can go from verbal abuse, emotional abuse, right up to the physical abuse. So we really hear that gamut of, people who are being sexually assaulted. We hear about people being assaulted by staff, by residents. And we also hear from the families of the assaulters as well, because a lot of this time, if it's a family member who has dementia, the family may know, and they're concerned too. They don't want this to happen, and yet the system is just unable to deal with all of these situations.
And when we're talking about, that hidden camera, there was a particular incident that we played on the Marketplace show where there was a resident trying to get into another resident's room. An altercation happened. Only one staffer on board, able to help and try to, she tried her best anyway to sort of separate the two. But I mean, days later, one of the men ended up dying.
That's right, yeah.
That's another issue too, is that when these incidents happen, the staff, I mean, where are they? And how can they aid in this?
Sure, and a lot of the time it's, that you don't have enough staff on the floor, even during the day, but it's going to be much easier during the day if it's at evening or at night. You have a very skeleton staff, or on a weekend, they may be staff who are, especially at nights and weekends, you're going to have a lot of temporary staff that come in to fill in. And that creates problems because they don't know who the people are. Even if they do, they may have to change 20 people at night, and you don't have the time to be kind of wandering the halls. And this is where, a lot of people with dementia wander at night. They do get up, they do get into these hallways, and where there's a blind end, like in this situation, what happens is they get to the end of the hallway, and what do? They go into the first room that's there. And so if you're at the end of the hallway, it's a problem. And I've seen this on hidden cameras before. It's been a problem.
Wandering is a problem all around. I mean, I even have my mom's friend, he's been in the hospital, and there's wanderers there that she has to keep shooing away. So it is indeed a problem. Hussein Juma asked this: is there a tort claim, criminal claim with regards to what happened last week? So that incident I was talking about on camera. How did those employees get off the hook so easily?
Well, I don't know what happened with the employees, so I can't really say.
Fair enough.
And sure, there is a tort claim. The problem with dealing with seniors very often is that they certainly don't go to court, these cases, and the value of the senior can be quite low, and it makes it a real problem because the society doesn't value them. And so especially if they die, there's not often the ability to bring a claim. People don't have the money, but many of these claims do go, but they get settled, and so. There definitely are tort claims and potential criminal claims as well in certain cases.
Another question here from Reiner Canis, I hope I'm pronouncing it right, says, we need to take the profit factor out of the system. Do you think that is an issue, that these are for-profit long-term care homes and nursing homes?
Well, in fact, the situation that we're talking about is in a not-for-profit facility that actually is quite wealthy. It raises lots of money. So we do hear a lot about that profit sector. There are good and bad homes in each. Definitely, I think a lot of people do feel that in the for-profit sector, they're taking money out of the system. But the fact that you have someone in a for-profit or a not-for-profit doesn't necessarily matter. And the case in Ottawa, those are City of Ottawa homes that they're having issues with, and they're municipal, so they're not for profit as well.
Right, because I was going to say our hidden cameras captured personal support workers talking to a government inspector and saying, they're so short-staffed, they don't have the time to bathe and to sometimes even feed the most vulnerable, which is astounding.
That's right, and that's the biggest problem. We don't have enough people on the floor. We really are pushing a lot of people out of hospitals into long-term care where they may have been in a chronic care facility before. They may have been in all sorts of different situations. And the problem is that we didn't bring the money with them. So when you had people in a hospital, you get a much higher staffing ratio, much higher level of care. You're getting nurses where, if you're getting PSWs, you really need to have enough of those workers to do the job, and we don't have that right now.
Yeah. A lot of people, including Sherry Thorne Bradshaw, are saying the only way to protect our seniors is to put cameras in rooms so everyone can be held accountable. I know in the case, one of the cases in our piece last week, a camera was right there for everyone to see, and there was still abuse.
Yeah, and and that certainly doesn't help with the resident-on-resident violence because the residents don't care. They don't know, they don't remember. With staff, we've certainly seen hidden cameras where people are putting pillows over them during care, so cameras don't always help either. But there's also a privacy factor. This is a person's bedroom, and there's lots of people in long-term care who do not want a camera in their room. In the situations that we have, it's usually family members of an incapable person that are doing it. But if you and I had lived in a long-term care home, I don't think I would want a camera in my room 24/7. So there's big issues around whether or not we should have cameras in every room.
Is that frowned upon by some staff, would you say?
Having cameras in room? Yeah, lots of homes will have policies to tell people they can't put cameras in rooms. We don't agree that policy is legal. We think people can, and there's some sort of parameters around that. But a lot of homes are going to put them at least in the common areas, which is somewhat helpful.
Now, Sally Dollar is getting to a question that I have as well, is talking about the minimum ratio. So the ratio of staff versus residents, that is definitely an issue. There's no minimum across the country. She says this, and I just lost the comment for a second, but here, let me get back to it. Ratios of workers to patients, like in daycares, one worker per 5 patients. It sounds so easy. Why isn't it happening?
Money. It's a cost factor. It's very expensive. Probably you're looking at 1 to 8, 1 to 10 during the day, and more at night. So 1 to 15, I've heard 1 to 20. The only ratio that we have is there must be 1 RN in a facility at one time, and that could be 1 RN for a facility of 250 people at night.
Right.
So it's a money issue. We spend a lot of money on long-term care, and it would be very expensive, and that's why they haven't gone to that.
You think about it, though, it happens in daycares. It seems like, why do daycares take precedent?
So in daycares, generally you're paying for it. In long-term care, it's the ministry that pays for all the salary of the staffers there. You pay an accommodation fee, but that's really just for the room. It's not for the healthcare, because this is healthcare, and that's where the difference is.
A lot of people have questions around this, I'm sure you can imagine. This from Nikki Armstrong saying, PSWs are really underpaid for what they do. I know because I am a PSW. We are seriously understaffed, which puts stress on the employees and the residents. It's honestly a nightmare some days, and we need more PSWs hired. and a decent wage. I've seen many places hiring PSWs at $14 to $15 per hour. Minimum pay equals minimum effort.
That's right. And absolutely. And they are overworked, they're overburdened. The work that a PSW has to do in a day, especially in a long-term care home, is very difficult. And they're dealing with very difficult people, and they're getting assaulted. They're getting hit. Now there are ways to get around that, but in order to do that, you have to have a good workforce. And if you're only paying $14 to $15 an hour, you're going to get some people who are very dedicated and some people who are doing it because it's a job. I have a niece who's a PSW, and she does it because she's dedicated. She loves it. But a lot of people just do it because that's the work. It's easy work to get.
Yeah. And you think about it too, I mean, if you are overworked, we've heard of this, I mean, in the medical field in general, you're overworked, you're sleep deprived, underpaid. It's just a vicious cycle, it seems.
That's right. And a lot of PSWs, in order to make ends meet, will have two jobs. So they may go from one home to another. They may go from one home to private care. And again, that increases their sleep deprivation and stuff. So if they could have a decent wage, it would go a long way to helping it as well. But we need more as well. Yeah, definitely. Gail
Wildeman Scrow says, there should also be a record kept of any wrongdoers. I'm not familiar with that. Is there a record? Does it get documented when incidents happen?
So when incidents happen, the home should be keeping records. There is mandatory reporting, so that gets reported to the ministry. The problem that we have in long-term care right now, or in any care sector, is there is no PSW registry. So they're not a college like a nurse. So if there's a complaint against a nurse, and not all of these would end up in complaints,
right?
But if there was a complaint against a nurse, that would go into their college. There's no similar thing for personal support workers. So even if you have a complaint and you wanted to register it, there's nowhere to register it. So if a PSW gets fired, they can just go down the road and work. But with nurses and other professionals in long-term care, it only depends on someone actually reporting it to those colleges.
Right. And I guess too, where else could you report potentially? I mean, I know online, perhaps. Is there any way to do it on there?
So there is all of the reports that the ministry do are online, but the problem is they can be quite dense, and if the ministry goes in, even if there was abuse, if they find that the home dealt with it properly, they're not going to make a finding. And so it's a bit of a mixed bag, but if there is a problem, it does get reported online, and you can see it for every home in Ontario.
Oh, you can, okay. Janet Thompson asks, why won't the Minister of Long-Term Care enforce more staff and have more inspectors showing up unannounced?
Well, you'd have to ask the minister that question.
The minister did allude to in our piece that they are working on more hours, I believe, which would result
in hopefully
apparently in more workers.
And it depends on how it's done. Sometimes it's a big amount of money, and it sounds like a lot of hours, but given the number of homes we have a lot of, I think it's about 575 homes, if I remember correctly. So that, over everything, it's often doesn't translate into that much. The inspections, we do have inspections. They do take a long time sometimes to get inspected.
Right.
And that is a big complaint. We have a system that is quite inspection heavy. But whether that actually happens or not is a different question. There's supposed to be a lot of inspections. There's a lot of complaints about that.
In case you're just joining us, I'm Asha Tomlinson with CBC Marketplace, and we're continuing the conversation around our latest investigation, looking into long-term care homes and the abuse and the neglect that's happening in so many of them, caused by both residents and staff. And here with me to answer all of your questions on Facebook and on YouTube, Jane Meadus. She's a lawyer and elder care advocate at the Advocacy Centre for the Elderly. You have heard so many stories. Can you just take me through, especially when it comes to neglect, some of the stories you've heard? So
around neglect, we get a lot of, I'd probably say the number one complaint around neglect is the failure to change incontinence products. Many people are in incontinence products, and we get a lot of complaints about people not being changed, being left in wet diapers with feces in them, not being cleaned properly. And that would be, I would say that's our number one complaint. And we have still homes who say that they ration diapers, so they're only allowed to have so many a day, which they're not allowed to do. In fact, the diapers have been created so that they have a strip on them, and it shows when they're oversaturated. But in
Right.
fact, when you get to that oversaturated, it would be terribly uncomfortable. You'd never leave a child in it.
Right.
But this is to say, well, oh, it's not wet enough yet, we can just leave you. And that would, I would say, was probably the biggest problem.
Wow. And that
feeding
can
and
lead,
meals.
could that not lead to infections or?
Can lead to bed sores,
Yeah.
infections, all sorts of other problems.
Right.
Issues around feeding, so people not being fed properly, not getting fed properly. The staff might sit at a table and have 3 or 4 people to feed, so that's a problem. And use of lifts, that would probably be the other one.
Oh, wow. We have a number of comments coming in, so thank you. Keep them coming, and questions. This from Pixie. The level of care required by many residents is greater than the capacity of many of the workers. A 6-month guaranteed graduation for care aides is failing seniors. What do you make of that? Yeah.
Well, I think it is. I think that you know there are programs out there. There are some good programs and some bad programs for them. But again, I think it goes to the staffing. It does, you know, there is the training. And I think that, you know, we get people getting into homes and they come with good intentions, but then they start to cut corners because of the issues that they're running into. And because you can't do your job, you're running from one thing to another.
In an ideal world, what would you say would be a good minimum staff versus resident ratio?
So we look at, it's really hard to know what the numbers are, but we're usually looking at around a minimum of 4 hours per resident. So whatever that would run into for your staffing.
Okay.
That's pretty much what they say is the appropriate amount, minimum.
Okay. Carlo Dunca asked, I've heard of a system where cheaper room and board is offered to students, travelers, in exchange for some time to help out with the care of the elderly over the span of the week. Your thoughts on that?
So I don't know about the traveler one. I think that would be a big problem. I've certainly seen that. I've heard of that happening in some retirement homes. And that would be a lighter level of care. This is not for volunteers. These people need specialized care, and so that would not be appropriate, I don't think, for long-term care, because you do need a very specialized level of care, and these are people who have dementia and have all sorts of issues. It would not be appropriate.
And I know that in our story we had that one daughter who had her mother in long-term care, and she was actually a nurse, so she was able to do a lot of the duties because she's, you know, well versed in it, but that didn't help her in the long run in terms of how the staff looked at her. I mean, they didn't want that happening.
Sure.
How do you balance that relationship?
So that is another big issue. We get a lot of calls around that family dynamic. A lot of long-term care homes, you know, families are very welcome to come in. And a lot of families, whether or not you're a caregiver, like a professional, like a nurse, lots of families give lots of care into long-term care homes. They are changing diapers, they are taking their parents to the bathroom, they are feeding them, and all sorts of things. And unfortunately, what happens is sometimes people start to complain. And as has happened in that case, I believe they were restricting her visits. We've seen people being barred from long-term care homes, and frankly, that's illegal.
Being barred?
Barred, yeah. So the home will say
you're not allowed to come in.
We're going to, if you come in, they give them a trespass to property order and say you're not allowed to come into the home. And if you do come in, we will call the police, and the police will charge you. And we've seen this happen. It is illegal. Under the Long-Term Care Homes Act, a person has a right to have visitors without interference. Often these are substitute decision makers, so they also have a right to be there. People do, if they're the substitute, if the person's incapable, they have a right to be in the room while the person's getting care because they speak for the person. And this whole thing about barring people is really quite problematic, and it's something I wish the ministry would do more for.
What can you do if you're in that situation?
Well, you should seek a lawyer because you can challenge that. You should be reporting it to the ministry because it is illegal under the Long-Term Care Homes Act, in our opinion. And it's often a retaliation against making complaints. You complain too much, therefore we're going to
punish you.
And the other thing too is what happens is that some people will get frustrated because they come in and they see their parent in dire straits every time. And maybe they get a little frustrated, maybe they raise their voice or something, and then all of a sudden that's in the chart, and it's very difficult to you're not charting, you're not putting stuff in the chart about what you're seeing, and then the person's getting into trouble and getting barred, and that can be quite a problem.
Tammy Winger McVeeny says this is only going to get worse as the population ages. And she says that with no PSWs graduating or enrolling into programs, who is going to relieve us? Who is going to replace us as PSWs in the near future?
Well, I don't know that nobody's applying to these programs, but I mean, we really do need to have more and more PSWs, and very often it is people coming in, new immigrants coming in from other countries,
right?
And those are often the people who are providing that care.
Jacob O asks, long-term care homes. We're getting a lot of comments and questions, so thanks very much. So Jacob says, long-term care homes lobbied against any attempts to make regulations. That seems to be his question. I'm not sure.
Okay. Well, I can tell
Can
you
pick
that,
up from
well,
here?
I'm not sure what he's getting at either. I
Yeah.
mean, certainly long-term care is one of the most highly regulated areas. If you look at the legislation, so we have an act that has hundreds of sections, we have regulations that have hundreds of sections. They don't want that staff ratio. I know that's been an issue.
It has,
And
yes.
there's different reasons for that, because there's pros and cons on that. The way that we do it right now is it's supposed to be outcome-based. So if you can do the job with X number, you can do the job with X number. And the problem is, can you do it? And that's the problem, is that they're expected to do the job. And I take a lot of umbrage at homes who say, well, we don't get enough money to provide that level of care.
Yeah.
It's like, well, you're taking the money, you have a contract, you have an agreement with the government, that's the job you've agreed to do. So you have to figure out how to do that job with the money that you're given. It's not a surprise what the money was. So, they're not new to the game.
But overwhelmingly, we keep hearing
We
people
still
are
need,
saying
of
we
course,
need a
we need
minimum.
more, yeah.
That wouldn't obviously solve all problems.
No.
But it would at least be one step ahead.
We either need minimum a number of hours. We used to. They took it out of the legislation.
Right.
But we need a minimum number of hours that can meet those needs, or a staff ratio.
Yeah, for sure. Okay, we've got a couple more to go through. Stuart Vaught says, assault is a criminal offense. Why would it not be documented? So I know that you mentioned a lot of the time it is documented in most long-term care homes.
So obviously assault is. It has to be reported to the police in certain situations. Any assault by a non-resident must be reported to the police.
Okay.
If it's a resident assault, so if one resident assaults the other, the police only have to be notified if there is an injury. Okay.
Oh, I see.
So
Okay.
if
Okay.
if a staff member slaps a resident, that's an assault that has to be reported to the police. If a resident slaps another resident and there's no, injury, that would not have to be reported.
Okay.
It doesn't mean it couldn't be reported, and that's the other thing we get. So if someone's going around and slugging a bunch of people, but there's no injury, but they're doing it on purpose, of course you can always still report.
What about security guards?
So very few homes have security guards.
Yeah.
In my experience, there's a few that do. It's it's your home. There's a real question as to whether or not security guards are appropriate. It may be that there should be some kind of an elevated level of staff that deals with those kind of behavioral issues. And it's a controversial issue for sure.
Barb A. Walter wants to know, often patients who are abusive to others, what can we do about that?
Well, you have to make complaints to the home, and it is a very difficult issue because we don't have good programs for those people in the homes. We don't have good programs, frankly, in most homes. Part of the problem, in my opinion, is boredom. But you have to let the home know. The home does owe the duty to the residents of the home to keep them safe. And that's often a problem, is where you get somebody and everybody knows, Joe, he goes around smacking everybody or doing whatever. And the home says, it's just him, what can we do?
Yeah.
Nothing we can do. They do owe a duty, and there are things that they can do. But he also has a right to long-term care. It is a part of our health system. And we have to really figure out how to do that better, is to provide the care to everyone.
Yeah. So Marilyn Brewer says, the financial burden, and let me just The financial burden is devastating. The assessments for subsidy are totally unreasonable. I'm having to keep my husband with late-stage Alzheimer's at home as I cannot afford the copay that the government wants to place him in care. Even the copay for in-home care is out of my reach.
So the long-term care, there is a copay system. And so if you are a low-income senior, it's in the range of around $1,300 a month. It's based upon your old age security and guaranteed income supplement.
Okay.
It is a burden for some people. There's no question. Where if you want to keep your house and have your spouse in long-term care, it may not work out. Ontario is actually more generous than probably most other provinces. In other provinces, they actually require you to sell your house before you ever even get you get the subsidy. Right. So in fact, Ontario, we don't asset test at all. But in the end of the day, if you're using your spouse's income to pay the mortgage or whatever, it may not be possible to keep your house or what have you. And that's just the way the system works. It's, you'd have to talk to your MPP about that one. Home care doesn't have a copay, so I'm not sure if they're talking about purchasing private care.
Okay.
Yeah.
Can we talk about private care for a second before we get to some more of your comments and your questions? What is your opinion on that? Some people are saying, well, maybe we'd have better luck and better care if we did have a private nurse at home.
So lots of people do that. If you can afford to have someone in your home giving one-on-one care, and a lot of people do hire sort of caregivers who do come in the home, that is always helpful. And it really depends on the care that the person needs. Right. That certainly is something people do. Some people look at the retirement home sector. That's more problematic because you are paying for the full freight. So you're paying for the care and the home. And they have different rules. It is a tenancy. It is not a healthcare facility. And so it's really a buyer beware system. And if you have someone with severe Alzheimer's, it can cost you $5,000, $7,000, even $10,000 a month for that care. And there's obviously no subsidy because it's private care. Yeah. And they don't have to meet the same standards.
So
people
it doesn't
have to
guarantee that you'll get
it doesn't mean that
care.
it won't, but it's a buyer beware system, and you have to be very careful.
Okay. Timothy Stephen, and perhaps you might have more knowledge in this than me, Jane, but he'd like you to comment on the issue of polyfarm and the fact that it's brought up by owners of care homes, residents, families, and staff.
So
polyfarm. Maybe if Timothy, if you could,
are you talking about? I'm not sure what he's
about that.
Maybe just clarify. I'm not sure if he's talking about multiple medications or something else. So maybe if he can clarify, I can make.
Let's talk about that though, because I know that there has been an issue with the fact that there was over medication some years back, particularly for people with dementia, Alzheimer's, etc. That's kind of gone down with pushback, and we're seeing a higher rate of violence. Can you make the cause and effect here?
It's really hard to make that cause and effect. There may be a whole bunch of reasons why we're getting more, quote, violence. Is it really more violent, or is it just a better reporting system? We really don't know, and that's certainly one of the things. Medication is really it's a very touchy subject. Use of antipsychotic medication in people with dementia, it's really not a dementia drug, and really all it does is just drug them up. It's not curing anything. Lots of people are on these medications though, and it's up to the person, if they're competent, or their substitute, to make that decision. It's never up to the home to make that decision. But frankly, I think better care and more, as I said, more programming for people. If you go into homes a lot of the time, throwing around a ball once a day and then being stuck in front of the television all day, I'd get kind of bored too. And so I think that's part of the problem, and we really have to work out how do we provide more stimulation for people in long-term care, and I think that would go a long way to deal with some of those behaviors.
Christine Henderson asks, why aren't there any security guards on the floors with dementia patients? This could help with the aggressive residents, as a lot of the nurses cannot intervene as they are not qualified to deal with these situations. You did make reference to this, but any more insight into it?
Yeah, I mean, I think it's a better educated staff, and maybe, it's up to the home to do that staffing, to decide what they need. And there have been complaints, if you have, PSWs. I talked about my niece. She's, 5'1" or something, not a big person. So if she has a violent resident, it's going to be difficult for her to deal with that, and that's something they have to deal with. I'm not keen on the security guards. I think maybe a better level of PSWs, maybe special training for those people, because I really find that really security guards have a certain mindset, and that's more the policing mindset. And that's really not what we need in dealing with people with dementia. It's a totally different animal.
Right. What about if you had maybe a security team on call?
Again, security is an issue. I mean, if it really gets to that, you can call the police, but I think that it's better training in dealing with these things. And if there's a specialty, people get specialties in medication and in also behavior and all sorts of things, and maybe there'd be a specialty that deals with, and we do have that. We have behavioral supports, and that's what they're supposed to do, but it's more of the how to deal with it, but not the physical part of it. And it does come up occasionally that they really want someone that sort of has that more physicality to them. But I really have an issue around the security guards. Now, saying that, we certainly do see people sometimes who do have sort of a one-on-one in long-term care because there's a behavioral issue. There is some funding for that from the government. So if there are issues, the homes will put one-on-one on a person to make sure that they're being safe, and then try to resolve that. Some people get sent for assessments to figure out what kind of programs to put in place, and the problem is sometimes that they get sent but the programs never get implemented, and that's always a problem too.
Yeah, I would imagine. Crystal Schmidt says, what can Canadians do to ensure the ratio gets legislated? We keep hearing about this ratio, Jane. I mean, so everybody wants to know, why can't we get something in place?
What you need to know is that this is part of healthcare, and healthcare is a provincial jurisdiction. So the way to change it is to go to your MPP, your Premier, your Minister of Health in your province, because it is provincial. A lot of people, talk about, well, if we just go to the feds, well, no, that's not going to help. So you have to go to your provincial legislature and have it mandated. As I said, Ontario actually has probably one of the most regulated industries of long-term care in the world. It's very heavily regulated, certainly much more than in Canada. A lot of the provinces, you will find very little regulation actually about long-term care. It's a bit of a black hole in lots of places. So if you want that regulated, and if you want long-term care properly regulated, you have to speak to your provincial legislators.
And when you say speak, so should they be writing letters? Should you be trying to get a meeting with a government official? I mean, I guess you could do all of the above?
All of the above. Okay. You want to talk to your MPP, you want to write to the Premier, petitions, all of that. You have to really push. It's incidents like the Wettlaufer matter that happened last year with the nurse who murdered the residents. That shone a big light on the problem in long-term care, and that's when you get changes. It's often, unfortunately, incidents like that, programs like this, it gets that out there, and you need to go to the minister. We went to the minister here, you went to the Minister of Health in Ontario, but you should be, in your own provinces, you need to be going out and speaking to the Minister of Health, speaking to the Premier, and saying, what are you doing in our province?
So be persistent.
Absolutely.
Yeah. Louis Durbidge wants to know, please talk about bed assist rails for bed mobility, turning in bed, getting in and out of the bed. I'm told that the ministry is against these support devices because of the danger of entrapment.
Right. So bed rails are very controversial. They can be a restraint if they are used to prevent people from getting in and out of beds. And we've seen numerous people being injured, getting caught in beds, people being strangled, lots of deaths. And so if it's to prevent people from getting in and out of bed, they go more with a high-low bed, so a bed that's close to the floor, and then it could be raised up when the care is being given. So then if they try to get out of bed or fall out of bed, they're falling onto a mat on the floor, and it's a very short space. There are people though who want them for pulling themselves up, turning themselves over, and it's really on a case-by-case basis, and you have to talk to the home. The ministry certainly, it doesn't prohibit them. There are rules around how the bed rails have to be used and safety issues, and I think what we've seen in a lot of the cases is when there's entrapment, perhaps the mattresses weren't the right size and all sorts of other things. So it really depends on the use of the bed rails. My mother had surgery last year for her back. She needed the bed rails to help her get up, turn over, absolutely. And if that's what it's being used for, that's the discussion you should be having with the home and saying this is why, and they would want to talk to the resident. But if it's an incapable resident who may crawl over them or get caught in them, that's where you have a big problem. So it's a big issue.
So you have to assess.
That's right.
If you have someone in a long-term care home, and then talk to a staff worker.
That's right. You would want to talk to the director of care around that if you did want bed rails. And we get lots of people who want bed rails on the bed to keep them from falling out. And we talk to them about, here's the problem. This is why they don't use bed rails. And I've probably had more people with issues because they had the bed rails than I get complaints when they didn't.
Okay. Again, I'm Asha Tomlinson with CBC Marketplace, and we really are continuing this very important discussion with Jane Meadus. She is a lawyer and an elder advocate, and we really should be talking about this because we've known about it for so long, and it really takes a program, or like you said, sadly an unfortunate incident to happen for us to sort of revive the discussion around how do we improve long-term care across the country.
Right.
And we have Crystal Schmidt asking, are there minimum educational requirements for each home?
So there are minimal requirements for different, absolutely. So there has to be PSWs do have to have training now. That didn't used to be the case. So it used to be that you would be able to just sort of go and work at a home. You now do have to have a accredited program. And obviously RNs, directors of care, they all have to have certain levels of training, absolutely.
Is it a case of if you get that training, you get it once and then it's sort of, it is what it is, and maybe do people forget? Do there need to be refresher courses? Are there refresher courses?
I don't know about refresher courses. Certainly there's sometimes training available in the homes. Probably for PSWs not enough training. And unfortunately, often the training that they are required to do, because there's certainly mandated training, but it usually has to do around abuse and things like that, so not hands-on training. I think that the problem is that sometimes they're required to do, being asked to do that on their own time, and as we already talked about earlier, they're getting paid not very well, and then they're told, well, you have to stay an hour to do training, and that can be a problem. So it has to be done in the home during their time, and it has to be paid, which means that the ministry should be paying extra money to backfill, because you can't just pull the person off the floor and say, well, everybody's in training now, so good luck for you. It's very complicated.
That goes into our next question, compensation. Coley Coral wants to know, would compensation for family caregivers be a federal or a provincial issue? Now, from what you're telling me, it's more provincial.
I think that I think probably it could be either. It could be a federal program or a provincial program, depending on how it's done, whether or not they're tax rebates or actual some sort of funding. I'm not seeing that. And I know a lot of people say, well, there are programs for hiring someone, so why can't you just hire me? Again, we have had some change around time off from work, where you're allowed to take time off, but of course, not lose your job for a certain kind of caregiving, but of course it's unpaid. And the system, frankly, really does rely on a lot of unpaid caregivers. There's so many spouses, children, taking off time to take care of their parent, and that's a big problem, because we hear a lot about that from hospitals, where people are saying, well, we need to discharge mom, and you need to take off from work, and too bad for you. You should, if you were a good daughter, you would take off 6 months to take care of your mom until she gets into long-term care.
Easier said than done.
Absolutely, and so with the reliance on the unpaid sector is huge.
That leads into this comment from Erica Brooks. As a compassionate, loving personal support worker working in long-term care for 12 years, change needs to be happening. It's very sad, and not everyone is doing what they love. There needs to be more support for workers doing such a physically demanding job. and so with such little support from the Ministry of Health.
Absolutely, and I think that we saw that on even on the video. We saw the support workers actually telling the inspectors, which is great, saying, look, we can't do the job. And I think that if you're talking to the support workers and they're saying, we physically cannot do the job that is required of us, I think you got to listen to those people. They're the people that are on the ground, and I don't think anybody would disagree with that. There would be very few people who would say, oh no, we have lots of people who have lots of time.
Yeah, and I mean, a lot of the time it is they want to do the best job
That's
they
right.
can.
Absolutely.
They're not all bad apples.
Absolutely
and
not.
It's just that they physically can't. There's not enough hours in the day oftentimes.
Absolutely.
Yeah.
You've got to take care of X number of people, and the baths, you've got to bathe so many people in a morning. And you have 20 minutes a person to get them, use a lift, get them changed, get them in the bath, be safe, get them out. And sometimes those people require 2 staff members to do, because you've got to have 2 baths a week, and that person may be a bit combative, especially with severe dementia.
Right.
And so it takes other people off the floor, and you need enough staff. A lot of it does go down to staffing for sure.
Tammy Winger McVeeny wants to talk about mentally ill people in long-term care. It's not a place for these people, she feels. They don't get the help that they require, as well as creating violent situations amongst them and the protection of these frail elderly. So what is being done to create mental health beds?
So there are no, what I would say, mental health beds in the system. It is a problem. One of the problems with the long-term care sector, certainly in Ontario and I think in other provinces as well, is that it has become the dumping grounds. We talk about the deinstitutionalization of the mentally ill, of people with disabilities, all sorts of things. And they said they closed all these facilities, and where do they end up? Everybody ends up in long-term care homes. So I have a 25-year-old client who lives in a long-term care home because of a physical disability, and she has nowhere else to live, so that's where she lives. Is that appropriate for her? Absolutely not. So if we're going to house them in long-term care, it doesn't really matter what we call certain things.
Yeah.
We need to provide the right kind of programming. So you don't stick someone who's 25, for example, in with a bunch of 80-year-olds. It's just wrong. I think everyone agrees with that. But when you have no other option, what do you do? And so we need to create the right programs, whether it's more supportive housing. We need way more supportive housing. So housing where people can get the care on site, but have more privacy, and it's, have their own apartment or room or what have you. We need a lot more of these sort of programs, and the problem is we don't have them.
A YouTube viewer wants to talk about the quality of the food served in long-term care homes. What's being done to make good meals for people in rest homes?
So in long-term care homes, I mean, they get a certain amount of money, and it's not a lot. I think it's around $9 a day right now. I could be wrong on that, but I think that's the number. And it doesn't sound like a lot. They do have to meet certain nutritional standards. There are inspections around food. Probably the very high complaints around the food. We have residents council. I know they take a lot of complaints around the food and the quality of food. And I think that people just have to really complain. If they're unhappy with the food, they have to talk to the home. Part of the problem is that you're dealing with such a wide range of population and tastes and everything, and that can be quite problematic, and they have to provide a lot of different types of meals. And so it can be quite difficult.
We want to talk about tips, because you know very well what to look for, what to look out for as well, for those who may be shopping around for a long-term care home for their loved one. So let's go with the top 4 tips that people should be looking for and the questions they should be asking.
Sure. So you first of all, never go into a home or put a family member into a home that you have not actually seen. So don't put a home on a list unless you've actually seen it. There's some repercussions if you refuse homes, especially in Ontario, so you want to make sure you've done that, because nothing will replace that at all. So that would be the first thing. Look at their inspection reports. Those in Ontario are available online. Unfortunately, in some areas of Canada, you can't actually get them. But if you can, have a look at their inspection reports. You want to ask around. talk to people. Do you know anyone who has family there? See if you can find people who have family in those homes and ask the questions. And I would say those would be the things that I would be looking at first.
Yeah, it's interesting. I'm just looking at some of the notes that we have on this, and just based on the province. British Columbia, not as detailed as others when it comes to records. There is an annual summary. Alberta releases its decision summaries of allegations of abuse. Saskatchewan, annual summary of incident reports. Manitoba, no public release. Quebec, mandatory reporting, annual report on incidents and accidents. No public release in Nova Scotia or New Brunswick. Prince Edward Island, there's a summary of serious incidents on a quarterly basis, but doesn't break down by type of incident. Newfoundland and Labrador, no public release. Same goes for Nunavut, Northwest Territories, and Yukon. So just for everyone across the country, if you want to know, here's your information on whether those details are out there or not online.
And I would be going to the province, and I know that there was just recently some work done in Nova Scotia, for example, where they were trying to get access to the records and having to do freedom of information, and then the reports that they got were all blanked out, like they were all crossed out. Redacted. So I think that's something that's really important. You really need to talk to your provincial legislature and say, this is really, really important. You need to get these things out there and online because you need to hold these people accountable. They're using public dollars and they're taking care of one of the most vulnerable populations that we have.
Indeed.
And you can't be hiding that. And in Ontario, we sometimes complain about our reports, but they're still the most robust of any in Canada.
We're getting close to wrapping up here, so if you have any other comments or questions for Jane, now is your time. But I guess I want to ask you, we saw on Hidden Camera some of the tours, and the workers there, the staff would say there's a minimum ratio, and they were telling untruths. How do you get around that? What are some of the questions you should ask? Are there follow-up questions to sort of get to the real nitty-gritty?
Right. So I think those are difficult questions to answer, because you can never figure out exactly what everyone's telling you. You can look at the legislation that's available online in any province. You should be able to look at the legislation and ask. You could ask the government. The Ministry of Health, if you have concerns about that. We know anybody watching this now knows there's no minimum ratios.
No minimum.
And so you ask those questions, right? Now the home may be able to say, this is our minimum ratio, and maybe the home has their own, but it wouldn't be legislated.
Right.
So you have to ask the questions, is this your policy or someone else's? It's very difficult because it's very complex. And so it's really hard to figure out what questions you need to ask. We published some information on our website about how the legislation works. Other provinces, as I said, there's really very little. You might find some manuals, some policy manuals on the website. You may not. And so it's very complicated to figure out what actually are the rules of the game in each jurisdiction.
Is there any one thing universally that people should be asking, you think, on a tour or a visit?
I think it's hard to ask that question. I think you can ask things about the ratios, like how many staff do you have per resident at night, how many during the day, what's your average of the home? I think that's a fair question, and the home should be able to answer that question. But I think really getting a look at everything is really what you need to do. You want to be able to smell things, you want to be able to look at things. Are they hiding things? If you ask to see a certain floor, are they saying we won't take you there? Right. Why is that?
What about visiting at different times of the day?
Yeah, it's hard when you're not in the home. We also definitely tell people who have family already in a home to visit at different times of the day. Okay. Because you really want to see what's going on at different times. The problem with going in and just kind of wandering around is, these are people's homes. There are some privacy concerns. And so we really don't want people just to sort of wander around. But if you can find a friend who has a family member in there, I would suggest that you do that and go in and have a look.
We have a few last questions and comments. This one from Timothy Stevens. There are so many ways and different ideas to care for seniors in Ontario and all over the world. If you were to think way out of the box, and what ways or things on a wish list can be put out there to consider?
Well, I think we've seen some of the really interesting things coming out of some of the countries in Europe where they have these villages where people can go and shop. They can do more meal preparation. They have these little villages. They have bicycles and all sorts of things, but they're sort of enclosed, so it's more like a little town. And so they're more engaged, and I think it would be really nice to get something like that. It would be very difficult to change given the number of people we have in Ontario in long-term care to do that on such or in Canada on such a large basis, but I think that moving into something like that would be very helpful.
And that number is growing. You did mention stimulation, that's really important to keep a community going.
Absolutely, and I think that some of it has to do with staffing, some of it has to do with rules. So, in some places, the residents help with meal preparation. That would be not allowed here because there's so many rules around the kitchen in Ontario, for example.
Right.
But how could we rejig the system so that people are more engaged to do things? And I think that would be really helpful.
Anna Campagna says, how can we assure that an elderly patient who needs 24-hour care gets it?
Well, so it depends on what do you mean by 24-hour care. When you're going into long-term care, you do not have one-on-one care. You have people available 24 hours a day. But again, it's not on demand exactly. There are call bells. So are call bells being answered? And that's one of the things you look at in reports, if you can get your hands on them, is are there any complaints about call bells? If you go in to sit the home, do you see lights or bells flashing and people aren't getting answered?
Right, okay, that's interesting.
And so it is difficult to know how much care they're getting and where are the staff when you need them on off time. So if you have an issue and you do the call bell, all the staff doing other things and they can't get to you. It's a very difficult thing to figure out, and again, that's why we tell people to go in at different times during the day and see what's happening.
If you haven't watched our story on Marketplace, it is available on YouTube. It is called Crying Out for Care. I mean, watching it's disturbing, no doubt about that. It is shocking, but it's also very helpful in being aware of this problem and what to do about it. If you could offer that silver lining, just a little bit of hope for so many people who are really feeling depressed right now about the situation, what would that be?
Well, I think that there are lots of places who are doing it well, and you have to really shop around. I think part of the problem is that those homes often have very long waiting lists, but you need to look around, and there's lots of homes that do have have no problems, have good reporting systems, and have very caring staff, and have no problem, really are doing a good job. Obviously, when we're doing stuff like this, my job, we're hearing about the bad apples, and so there's lots of people out there who are doing great jobs.
And just on Anna's note, she says, having assisted my parents at end of life, as well as aunt and uncle with Alzheimer's and Parkinson's, she's found whether it's in home care situation or a long-term care facility, one comes to a point where the issue she calls abandonment arises. What do you say to that? How would you be able to fix that? I mean,
well, it depends. Are you talking about abandonment by family members or abandonment by the system?
It sounds like she says the system, the patient is left on their own.
Right, and that is difficult in long-term care, and that's why you want to go in and see what's happening with people, what kind of programming. Are people just being left in their rooms or in hallways, or are they being stimulated? And I think that's one of the big questions that I would ask in long-term care as well, is what is going on, and how are you going to make sure that my mom isn't just sitting in a hallway bored all day?
I'm Asha Tomlinson with CBC Marketplace. Jane Meadus, thank you so much for your knowledge, your expertise, and just, the gratitude, I'm sure, from so many out there for the work that you do. It is so very important for our most vulnerable population that is growing, as I mentioned. So thanks again for answering all those questions and for being available for our Facebook Live, and we're also live on YouTube. In case you missed it, Jane Meadus is a lawyer, and she's also an elder advocate for the Advocacy Centre for the Elderly. Thanks so much for watching, and hope you continue the conversation well beyond this live. Yeah, it's interesting because I know a lot of people, they've passed around the video, and you just apparently, from what I'm hearing from Cheryl, who's looking up the comments, there's so much gratitude out there for having this discussion. I think we're too often, people don't want to talk about it. It's hard.